Senator Singh.
Thank you, Mr Acting Deputy President. I rise to speak to the Fairer Private Health Insurance Incentive Bills package introduced by the Gillard Labor Government. At the core of Australia's progressive income tax system, supported broadly by both major parties over a long period of time, is the basic observation that some in our community do not have the earning power of others, and that taxing those people at the highest rate would be unjust. It is based on the observation that those who reap the prosperity of a strong and stable economy should give back to the society that has created the conditions for their success. It is also based on the understanding that those who earn more are able to satisfy their fundamental needs and have the opportunity to use their additional income to make choices about their lifestyle and their priorities. These choices are less often available to those on lower incomes, where a higher proportion of money earned goes on the basics, on the essentials. In this country, we have a robust public health system. All Australians are entitled to primary health care, to hospital cover, through the pharmaceutical benefit scheme and, of course, our universal Medicare system. Labor has always been committed to universality of health care because we have always been committed to equal access to the fundamental determinants of equality of life. But Labor's approach to public policy, and the approach reflected profoundly in the Australian character, is one of fairness. That so many people should have the opportunity to use their prosperity to expand their life choices is something about which Australian society should be proud, and Labor certainly is. But it is the goal of our party to extend those choices and that freedom to all Australians. The options available to the few should never be at the expense of the rest of society. Throughout the tenure of the Howard government, that is exactly what happened. The Coalition pursued an agenda that was not about good, sound public policy and economic management. Instead, the Coalition dedicated itself to strengthening its support amongst higher income Australians, establishing a number of vast spending programs that directed money not where it was needed, but instead where it was politically advantageous for them. While there are a number of examples of this policy, from youth services to tax cuts to education, there is no clearer example than the subject of today's bills, the private health insurance rebate. This scheme was ostensibly designed to encourage Australians into private health insurance and take pressure off the public system, a euphemism constantly employed by the Coalition for ripping money out of basic health services. This scheme, in its universality, was based on the notion that the private health insurance market in and of itself does not provide adequate incentive for Australians to subscribe to it, quite contrary to the market fundamentalism usually espoused by the Coalition. Under the Howard scheme, approximately 14% of single taxpayers who have incomes above $80,000 received about 28% of the total private health insurance rebate paid to singles based on their average premium. Approximately 12% of couple taxpayers who have incomes above $160,000 receive about 21% of the total private health insurance rebate paid to couple based on average premiums. These figures represent a significant overrepresentation in expenditure towards these population groups, the population groups that are far less likely to require a rebate in order to have their access to private health insurance. In fact, were their rebate levels reduced in the manner proposed by these bills, it is predicted that 99.7% of private health insurance policyholders will choose to retain their cover. This means that Australian taxpayers on low and middle incomes are subsidising Australians on very high incomes, on the basis that those on higher incomes deserve an incentive to opt for private health. Mr Acting President, it is incomprehensible to me that fairness could mean that those who work in aged care, in community care, as cleaners, as childcare workers, should be subsidising the very well-off. Ignoring the fact that this rebate could not achieve its function of providing a genuine expansion of choice or incentive into the private health system, the Howard government chose to introduce this policy, which has now become the fastest growing of healthcare expenditure. But this is typical of the fiscal management of the Coalition, which has always chosen to redirect precious public money into an area of political rather than social gain at the expense of the broader health system. Mr Acting Deputy President, the bills before the chamber right now present an effort by this Labor government to not only build fairness back into the system of private health insurance, but also to restore fiscal and budgetary responsibility into the management of our health system. In the 2009-10 budget, the government announced that it would introduce means testing for private health insurance rebate and increase the Medicare levy surcharge for people on higher incomes who do not hold private health insurance hospital cover. Means testing for the rebate will be implemented over a number of private health insurance incentive tiers. The tiers will establish 4 income categories, the first of which singles earning $84,000 or less and families earning $168,000 or less will continue to receive the full rebate. These are the people who do not necessarily have access to the suite of options of discretionary spending like on private health cover. These are the people who will benefit from some assistance that just might determine whether they are able to access private health. And despite 9 out of 10 Australians not being affected by these changes, these reforms will result in savings to the public balance sheet of more than $2.4 billion over 3 years, which will be reinvested by this Labor government into services that all Australians need. And as the Minister for Health said when she spoke on these bills in the other place, it is next to impossible to find another item from the health budget like this one which can be cut without an appreciate effect on the services that Australian taxpayers enjoy. There could hardly be a clearer indication that the scheme was poor public policy to begin with, and that only 10% of Australians being affected by the change, and contrary to the opposition's assertions, only 0.3% of Australians predicted to alter their cover as a result. The Coalition asserts that as a result of changes in the private health insurance rebate, premiums will rise, putting pressure on low-income policy holders. Of course, it doesn't take an economist to notice that premiums for private health insurance, indeed the cost of healthcare generally, goes up each year. When the Leader of the Opposition was the Minister for Health, rises in private health insurance premiums were as high as 7% per year. Premium rises are averaging at the moment at around 5% a year, thanks in part to the strong and stable private health sector which this government has fostered. But the point is that the Labor government supports industry and the health sector with fairness. And in order to make access to private health both fair and responsible public policy, serious reforms of this type are very much needed. Where the Coalition designed policy for the wealthy minority, the Labor Party will always dedicate itself to design fair policy for a strong society, the setting for an economy in which all people have the chance to succeed. While I have no doubt that the private health insurance rebate is appreciated by those who received it under the Howard government, it is not and should not be the priority of government spending when those in genuine need and assistance are still struggling. There is a clear correlation, Mr Acting Deputy President, between household earnings, socio-economic status and health outcomes. In my home state of Tasmania, we are fortunate to enjoy a unique quality of life, but sadly many do not have the health to enjoy it. In fact, health inequality is one of the biggest challenges facing Tasmania right now, a state with the second highest burden of disease and injury of all states and territories. The average Tasmanian adult working full-time earns less than $1,200 per week, making the average income less than $70,000 per year. The high levels of cardiovascular disease, cancer, diabetes, asthma, lung disease, kidney disease, arthritis and depression that Tasmanians experience disproportionately affects those with lower incomes. These are the people who government needs to assist. These are the people for whom welfare must be directed, those in genuine need of the compassion which binds together Australian society. These are the people for whom Labor is dedicated to directing its support. those who do not have the freedom about which this opposition mouths platitudes but denies in practice. This bill is not about undermining the private health insurance sector, a sector that has grown with 960,000 more Australians holding policies than when this government took office, and a sector that continues to grow. It is about recognising that if we are genuine about providing health solutions to people, then we must direct government funding to the areas in which there is genuine need. It is about recognising that if we are to provide choice and to provide fairness, we must make sure that where government subsidies are used to encourage participation, they are true and useful incentives. And most of all, Mr Acting Deputy President, these bills are about recognising that good public policy must reflect the character of this nation and be imbued with the sense of fairness that is at the core of being an Australian.